the Real Fathers Initiative. Real stands for Responsible, Engaged and Loving Fathers. And the two people you can see here are from Uganda, from northern Uganda, in the district of Amuru. And that is a region that had been heavily affected by civil war about 10, 15 years ago. And there you can still see obviously you can still see the effects of that. So just an overview of what Real Fathers includes. We worked alongside a researcher, so we were the implementing organisation as Save the Children, and we worked with Georgetown University's Institute for Reproductive Health, and they carried out most of the monitoring and evaluation and the eventual assessment of how Real Fathers did. And the goal of the program was to develop and test a father-centered intervention to reduce physical punishment of children and intimate partner violence. So they were the two main outcomes we were looking for: physical punishment against children and the intimate partner violence. They wouldn't necessarily need to be married, but in this context, they usually were, but they were living together, man and the mother of his child. So as mentioned, this one is in Amuru in northern Uganda, but the expansion, which is where we decided to adapt this and scale it up in another part of Uganda, that took place in Karamoja, which is in the east, which is an entirely different cultural context. And the specific objectives, we wanted to increase positive parenting practices and fathers' interaction with children, and to increase self-efficacy for parenting, decrease the use of physical punishment and intimate partner violence, as I said in the goal there. Like in a lot of places, dads do want to be involved in other people, in their children's lives, but there are many obstacles as to why they're not. And I'll talk about that in the formative research. So the global evidence indicates that if you're a kid and you've witnessed harsh punishment against either your siblings, or you've experienced it yourself, or you've witnessed your dad be violent to your mum, or vice versa, these are risk factors for later being a perpetrator of intimate partner violence. Whilst the evidence indicates that, I think that is common sense just in a lot of our lives. We probably know somebody who is in that cycle, maybe at some point. We know that involving men is more effective than an exclusive focus on women. And again, that's kind of common sense, because a woman can be as empowered as you like, but if she doesn't live and work and breathe in an environment where she's allowed to do the choices, to sort of live the choices that she's making, then it's not only very demoralizing and potentially dangerous for her, but it certainly doesn't achieve anything that she wants for herself, or that we're hoping to achieve. We want to reach men before the relationship expectations, attitudes and behaviours are set. So in this context, that meant men between 16 and 25 years, just because we all know it's kind of hard to change people's minds as they get more set in their ways and more into the habits of their relationships and parenting style. And we felt that fatherhood was a promising avenue to make some of these changes, especially around gender equitable masculinities, for those dads who have daughters and start seeing women sometimes, or girls, in a different light. Not all the time, obviously, but it's a pathway to being able to talk about some of those gender norms. And then we also wanted to look at the desired outcomes, the effect that it has on family planning uptake and maternal and child health. And we know that involving dads and male relatives is beneficial in this case, because if a woman isn't permitted, or for some reason, maybe she can't financially get to the family planning clinic, or because she's not permitted, if she's not allowed to go, even if she understands the methods available to her and she wants to take advantage of them, if a man is stopping her, obviously she's not going to be able to go. All of these reasons are why we would want to engage men. So this is just a brief overview of the study. We had 500 young fathers. They were randomly assigned to either the intervention or the control. There was a baseline survey, and then this is for the pilot, the one in Amuru. There were 12 mentoring sessions, 6 community posters, and at the end, a community celebration. And those 12 mentoring sessions were half of them were individual, half of them were group. Then there was an end line 3 months after this intervention, which took 6 months to do. And then, unusually, but very happily for us, USAID gave us funding to do a longer term follow-up, which was 10 to 12 months after the intervention. So we were able to see if some of the effects that we saw in the short term post-intervention was whether they were evident later on in the year as well. These are examples, and this is in Akoli, the language in Amuru, but these are examples of the 6 large posters that we put in the community for each of the modules. So as I mentioned, there were 12 contact points, 2 for each module, so 6 modules overall. And in one module, there would be a group interaction and an individual visit from the mentor. And those posters have emotion-based images. So for example, these aren't in English. These posters are saying things like, a real dad plays with his children. So you see at the bottom there, they're playing with some tires. They've got their dad playing next to them, and then at the top they're playing like with a little ball there, and it says that, for example, in this one it might say, I can't remember off the top of my head, but in this one it might talk about how community leaders say, you know, this is what a real dad does. In another poster it might say, the elders say, this is what a real dad does. The point is that we're taking people from the community, different groups, whether it be mums, family members, community elders, and their peers, and saying that all those people that affect social norms and might pressure somebody into behaving in a different way, they're supportive of you. They're saying that, no, this is what a real dad does. Nobody's going to say that, well, why aren't you acting like a real man, according to this poster. And they were displayed in different parts of the community at the beginning of each module, designed to catalyze conversation among the community, but also for a more visual focus that people can base their discussions around when they were in their group meetings. So I went through that stuff reasonably fast because I believe that you guys wanted to talk a lot more about male engagement, and which is a fascinating topic, and I support programs in different countries as well, Philippines, Bangladesh, Malawi, something that is not talked about as much, I think, as in the involvement of men, instead of the exclusive focus on women, is that men actually want to be involved. Some of the obstacles are definitely gender-based norms, social-based norms that are saying a real man doesn't take care of his kids. That's a woman's job. That is certainly some of the things that are happening, but that doesn't mean that that's what's going on in that man's head. We find a lot of the time, for example, in programs that I support in Dhaka, in urban Bangladesh, or in Manila, in the Philippines, is that some of those social norms aren't really that strong, and men would love to be involved in more of a participatory way, but they're working 18 hours a day, and our staff aren't working 18 hours a day. So those meet-up points are a lot less, there's a lot less opportunity for them. Or if you do go where dads meet, it's in maybe bars, in the case of Manila, not so much in Dhaka, or in late night meeting places where people are playing games, socializing with their friends, and it's not necessarily safe or desirable for our staff to go to those settings, and that would be very difficult for them, especially because in many places we have, for the health work that we do, predominantly female employees. So there's that to take into account, which we didn't see with Real Fathers in quite the same way as the number of hours in the day, but we did see, especially in Karamoja in the east, with the corrals, which it's a time of year when young fathers, well, a lot of men, but our cohort in particular, travel around with their cattle with the reins so that their cattle can feed and freed. So they would be out of the community for quite a long time, sometimes 3-4 months, and we would have to work around that. And that was difficult for obvious reasons. But the way that we did that is we had people either from the community, or all of our mentors were from the community, but people either able to go to the corrals and do these sort of catch-up sessions, maybe once every 2 months, they would go to where the young fathers were. Or we would time our intervention so that maybe they're just missing a couple of sessions and they could be done twice, 2 sessions in 1 month rather than 1 session per month, which would make up the 6 months of the intervention. So there were ways around it, but it was difficult when people disappear for a couple of months because they have a life and they have to do the things that they have to do to feed their families. Then the spacing, the timing it's not optimal. It's not necessarily comfortable for the participant to be able to practice the skills that they learn. So it's definitely something to take into account. Much of the reasons behind what motivates young fathers are context specific. Some of them are universals. Most dads want some kind of relationship with their child. You might see that they want more of a relationship with their male child. They don't feel like they need to be involved in their female child's life for a little while because it revolves more around control rather than wanting the boy child to take over a business or be familiar to him in like ways that he sort of sees himself. A lot of the time, what's on the surface, what's apparent, which might be that the woman is the one who's always taking care of the kid, isn't necessarily what the man wants. It's just what's expected. Within Real Fathers, the formative research found that praise and respect from the wife and children and the elders was a big motivation for them to take part in this program. The payment of bride price, that was specific to these 2 regions because if the couple weren't getting along, if there was a lot of intimate partner violence, the family could often raise the bride price, meaning that the marriage, he wouldn't be able to pay that and the marriage would effectively be annulled, or the bride would disappear back to her family without the bride price being paid instead of staying there with the understanding that it will be paid. So that was something that was very relevant to the fathers there. And they also wanted support to be successful in that difficult role. The young fathers especially, because of the structure of the community where elders are respected and people still look to them in ways to sort of improve their life, people weren't too proud to ask for that support. And that was a difficult thing to provide in an intervention where these are such personal matters. Now, this is interesting because if the motivation, for example, is connected to ideal masculinity around the gender power imbalances, so the examples given here are that 86% agree a woman should obey her husband on all things, or 81% agree that a man should have the final word about decisions. I might not necessarily agree with that. From my cultural background, I do not believe that a woman should obey her husband. I believe that there should be a 50-50 partnership between the two. So it's a difficult rope to walk on how much you take this formative research and tailor your messages and interventions to that in order to appeal to what the motivations of the father are, and how much you sort of say, well, these are some of the norms we're actually trying to change. We would like it that men don't think that it's okay to hit their wives. There's no cultural context that's going to persuade me that that's, and I'm sure many of you, that would be an okay outcome of this program. That's just not what we're doing. So that part there is quite a difficult one to negotiate. Some of them are much more obvious than others. For example, the interpartner violence, that's a non-negotiable. But when it comes to patriarchal norms that this intervention isn't going to change after centuries of perpetuation, requires a lot of compromise, and it's very difficult to get right.
Does women believe that men should have the final decision and they should obey their husband? Did you do it the other way around?
Yeah, we did do it the other way around. That's a good question. And it wasn't as high as 86%. And I cannot remember the percentage
Usually the numbers are high also from the other, not the same, but usually they are high.
Yeah, they're high.
You're encountering kind of norms from both ways. It's not just from the male. Okay.
Absolutely, yeah. Thank you for pointing that out. Yes, it was norms from both sides and the families as well of those people. It was not something that an intervention of this size is going to transform. That is something that we work with. The young fathers in the northern part of Uganda, they were recruited through an existing livelihood program that was being run by Save the Children there called Yield. And we identified 64 men as part of that recruitment process. And in Karamoja, we identified 36 men, and that was through an early childhood care and development program. The young fathers' families, like their child, were enrolled in. So we used those platforms for enrollment purposes, and depending on how you interpret integration, you could argue that the intervention was integrated into existing ones just through recruitment, or you could say like through the space and from a more logistic perspective. For example, some of the staff members were also sort of recruited from those areas too. The program itself wasn't integrated within like the content of what was being done in Yield or the content of what was done in the ECCD. So that's an important point to understand. And you can see that there are more men that were recruited in Amuru than in Karamoja, and that's because of geography. Karamoja is a much more sparse place, and also because of the requirements of the program, which were that if somebody has disappeared, if somebody has gone to the corrals for the vast majority of the program, obviously that's not going to work, and that happened more frequently in Karamoja. So that was how we recruited the young fathers. And then the young fathers themselves would think of mentors, think of men in their community who they respected, who were also fathers, who maybe they had a set of criteria, and it was different for different groups of men. They came up with their own criteria. Maybe it was that they had a job, or at least were able to work their land, make their own money, although it was frequently women that worked the land in these contexts, not so much the men. Or they were not drunk all of the time, which is a problem especially prevalent in Karamoja. And they sort of nominated these men who they felt, I could definitely take advice of this guy. And then we verified that with the community elders so that everybody was on the same page about who these influential people would be. And then that one mentor would mentor 4 dads. Either they would have each other's phone numbers, which was very unusual in Karamoja, where mobile phone's not really a thing. Or they would be living in the same, what in Karamoja they call manyatas, like basically the same kind of community where they would see these dads every day. Okay, so the results, I'm going to go through this fairly quick because I do want to leave a lot of time at the end for discussion and questions, and I will share the published paper with you all so that you can read the results in much more detail. When we compared survey data among men exposed to the intervention and those unexposed, we found significant reductions in physical child punishment at the long-term follow-up, which was the 10 to 12 months post-intervention, but not the 3-month post-intervention. So we can see that there is a reduction, but it's not a statistically significant reduction. Now, we haven't done further research to look more into why that is. That would be a great research question. We have theories. For example, it could be that the intervention and the posters and the advice that the mentors gave sort of disseminated through both the exposed and unexposed groups in the months after the intervention. That's the most logical one. Could be that the elders saw particular way of life of doing like positive discipline, for example, and wanted to encourage that, so it came from a higher point and sort of trickled down. Could be a bunch of things. It would be speculation at this point. We would love to look more into why that is. And here we have the percentage of men reporting any form of interpartner violence.
Yes, this is Swan from Action Against Hunger. I just a comment on the here the findings. It's interesting to have, the men reporting, but it's a self-reporting, so it might be biased. It could have been interesting. Maybe the result will come further to get the answers from wives and children to see how they perceive the IPV. Because here it's self-reporting, so men can mention that it has decreased over time, while it's not the case.
No, that's what I was saying. I think that is a clear problem in those results. It's percentage of men reporting. So we did not go to the women and the children are age 1 to 3. So we did not have people specialised enough to be able to talk to 1 to 3-year-olds to know whether or not that was true as well. It's kind of hard to get those opinions from kiddies that young. But with the women, no, we did not. It's all self-reported. So you would want to check with the women.
I have a quick question, like for the control and exposed group, you've done nothing?
Again, that is a good question because they were unexposed in the sense they weren't assigned to they weren't assigned to a mentor, so they didn't have either group or individual meetups to go through the sort of curriculum of Real Fathers, where they would do sort of participatory exercises on gender equality, intimate partner violence, positive discipline, all these kinds of things. The posters were up for them to see. They could see them, and there's nothing to stop them having conversations with their peers outside of our intervention about what they had discovered or learned, talked about, unexposed in the sense that they weren't with us, but we can't say that they were 100% unexposed from the intervention because some of them were in the same community.
So there is kind of a contamination effect.
Yes.
Okay.
Yes, it was easier for us to sort of go to one place for our exposed and then go to another place for our unexposed. In Karamoja, it was slightly harder to do that because of logistics, and so we see a contamination slightly more in the Karamoja results, which the Institute of Reproductive Health, they haven't released their analysis of the Karamoja results yet.
You started with 250. How much did you end up with? Like, how was the attendance rate, turnover?
The dropout was very small from what we were expecting. I think it was about 15 dads.
Okay. So it's a low percent because, like, from field observation, we noticed that it's really difficult to engage father, but once they are engaged, they commit better than women.
Oh, really? Is that what you found?
It's a field observation, like nothing.
Right.
Mm-hmm.
Okay. I have not seen that in what context have you seen that in?
In Lebanon, whenever we're engaging, like we had this parent deal, we had some program for fathers. It was so difficult to motivate them to start, but the moment they were starting, they were more committed. So they did all the session. We had like a small rate in 3-4 groups, not a lot. Low rate of dropout.
That's great. I'd love to hear more, perhaps outside of this, what you feel that the factors were behind that. Because in this, we think that the low dropout was because dads in this context are not running around all over the place working 18 hours a day. Both of these settings are very rural settings. So it was something to do, and it was like a way to meet other dads, meet people in their community, come together with the elders. It wasn't out of keeping with what dads would like to do in part of their like leisure time. And as I said, it's mainly the women that were working the land, and dads had a problem a lot with drinking and not working. Go ahead.
For the dads who provided the mentorship, is that on a voluntary basis, or have they received any form of incentives or?
So the incentives that they received in the first in Amuru were bicycles, so that they could get from
one place to another. Yeah,
exactly. As the use of bicycles, I know you're aware of. And then they were also given bags to carry their to carry their papers and to carry their notes. I was amazed when I went to. So I visited them a couple of times, and I was always amazed at how many notes that the mentors had made on the curriculum to adapt it even to the individual sort of family, which blew my mind. I thought it was so incredible that we were, we weren't paying these people. So that was great. But then when in Karamoja, not paying was slightly more difficult because economically it's a more difficult environment. So again, it's highly understandable why that is. But the incentives were more material. They were not financial. People weren't getting cash. Overall, the results 1 year after Real Fathers ended, young fathers were just as likely to reduce any form of violence, but the exposed group were more likely to reduce physical punishment against children. And this is just so we've got in the past 3 months and in the 10 to 12 months follow-up there. Yeah, it was more likely that dads were going to reduce the punishment against their children rather than their partners.
I'm amazed by the reduction in the control group also.
I suspect it's to do with how tight the community is and how the diffusion of the message went beyond the exposed group very easily, because the elders were involved, and so all of those big meetings, people were hearing the same message, and also because of those posters where people were able to talk about things regardless of whether they were in the intervention or not. But I would love to know more about why that was. Those are just theories.
It's just speculation, but it might be you raised awareness over the subject. Even though it's not true that they really reduced that much, they were not so comfortable to
say it. Absolutely, because people know when us guys turn up to places, they know what it is that we want them to say. People will not, especially after an intervention, but also before, because in a place like Karamoja, there's a road that you go down, and there's a sign that has about 15 NGOs on it. People are very aware of what it is that we're all turning up to do, and they want to encourage people to continue doing interventions and bringing resources to their community. Entirely understandable. So yes, I agree with what you're saying. It's hard to know whether or not it's a genuine report or whether it's because people know that that's what we want to hear. And one way to address that would be to verify those results with the women.
But even if it's not a genuine report, it's always a positive result. In a way,
but we all know that what goes on behind closed doors in private is often very different to what people are projecting outside. So more awareness is definitely a first step, but awareness doesn't always lead to behaviour change, and so it would still, in my opinion, it would still be interesting to understand more about that.
You had also posters, right, all around the communities?
That's right, yeah.
So that's probably another...
Yeah, as I was saying, there was no way that we could stop the posters from being seen by people that were not exposed. And so we see that in communities where there were more exposed and unexposed people living in the same place, that's more of an issue. In Karamoja, where geographically that wasn't as much of an issue, you don't see it quite so much. But the results of Karamoja haven't yet been released by the research organisation. Does that make sense?
Yeah.
The posters were put up, the place that they were put up was chosen by the community, but they were put up so that they could discuss them during the group sessions. And then finally, just to say that Real Fathers has gone into, it's part of a Parenting Without Violence common approach, and these common approaches are being developed by Save the Children so that we have a movement-wide response to some of the problems that we continually see across all contexts. So the Parenting Without Violence common approach aims to prevent violence in the home, particularly physical and humiliating punishment of children, and it builds upon the key elements from 3 tested Save the Children interventions, which were positive discipline and everyday parenting, Real Fathers, this intervention, and Children's and Youth Resilience Programme. There's a culmination of all of those elements in Parenting Without Violence Common Approach. And that's important because Real Fathers is adaptable, but it's also can be strengthened by lots of the other interventions that perhaps you work on, and certainly the ones that Save the Children has proof of concept on. So that's the end of my presentation, and I'd be happy to take any more questions.
A clarification on the paying the bride thing as incentive. I didn't get it.
If like in many cultures, when a man marries a woman, the understanding between the families is that the man's family will pay a significant amount of, either cattle or other types of resources to the bride's family or the bride price. And nearly all of the time, the man cannot do that up front. It's an agreement that the two are sort of married, although very rarely legally married in Ugandan law or whatever law, but common law married, and that he will pay off that bride price as time goes on whilst his wife is living with him. But this is kind of like a gentleman's agreement, if you like. So if the family feels like he's mistreating the wife, like IPV, or the family feels like he's not providing for the wife, he's mistreating the child, all of these kinds of things, they will take the wife back and say, well, you haven't paid the bride price for a start, and we're not happy with this union, so we don't want to endorse it, and she's going to come live back with us. And the dad doesn't want that to happen because it's his wife and because she will take the child with her. So finding ways to communicate with his wife so that it doesn't involve intimate partner violence, and so that it treats the woman much better, is an incentive for him because it reduces the chance that she will leave before the bride price is paid. After the bride price is paid, that's a different story. That is a lot more difficult for the woman to do. But these are young fathers, aged 16 to 25. Very few of them have been able to pay their bride price off yet.
I was interested to know more about the content of the 12 sessions. Could you briefly present
So
that?
I didn't include that information here just because of time, but I would be happy to share with you the full curriculum. And so you can see what the content is. But in a nutshell, it's about gender clarification exercises with the men. So things like whether or not a man believes that a woman should obey her husband, or if it's okay for a man to beat his wife if she hasn't made dinner that night. If dinner isn't ready by the time I get home, I can beat my wife. Those kinds of discussions would be had so that we could look at the reasons behind why a man thinks that, but also look at alternative ways to communicate with the wife, because we were very clear that beating your wife, not okay under any circumstances. So there's that. There's also some positive discipline exercises in there, but I can share the curriculum with you as it was written for Uganda. We also adapted it for Malawi. I led that adaptation a couple of years ago for different outcomes, which was to keep girls in school, which there hasn't been an assessment of. So I will say that with that caveat because of the type of program that it was. But I can also share that with you so that you can better understand what was in the program.
Yeah, that would be great. Is this an open source curriculum? Is it something that we can share with the task force members?
It is. Because it's USAID funded, it's open source.
Excellent. Thank you.
Was the program implemented other than within a research?
What you mean? So in Malawi,
implementation.
Yeah.
Yep.
In Malawi, Real Fathers was part of it's an ongoing program, is part of a much bigger project, which its primary outcome is to increase the number of kids that go from primary to secondary school in rural parts of Malawi, which require a lot of construction of secondary schools, and it's a whole other set of outcomes that they wanted to see, but they wanted to have Real Fathers written into it, and so we adapted it for that purpose. For this one, this was a standalone program. Apart from that integration with the livelihoods programs, that yield programs, and the ECCD ones in Karamoja, which didn't affect the implementation, it was more of a platform for recruitment. It was a standalone program. But in the positive, in the Parenting Without Violence Common Approach, then an entirely new approach was written with some of the elements of Real Fathers that people thought would work alongside those other two programs that have been implemented in many countries.
Any other questions? Did you involve the women at all in the process, or was it exclusively focusing on men?
Yeah, we involved the women in the formative research, and we involved the women in interviews in the community celebration, which I didn't talk about, which is at the very end. It's kind of like a graduation ceremony where the fathers make their pledges, make their commitments to the community about how they're going to behave in the future towards their wives and their children. And women were involved in that, and they gave testimony. There was also some qualitative research done with the women. In all honesty, I don't know where that ended up. That was being led by Institute of Reproductive Health, and I would love to understand more about that qualitative research. It didn't appear in the publications. It's certainly a criticism that women could have been more involved, but women also did turn up to a lot of the sessions, and they were part of half, maybe just over half of the individual sessions, because they were getting suspicious of what their fellas were doing, what their husbands were talking about all this time, and they wanted to know. So they joined those sessions and sometimes took part in those exercises, and you'll see that when I share the curriculum with you.
So we have a men engagement program that is with the aim of reducing intimate partner violence. And in this program, we have the sessions that are at the same time with women and men, but separately. Mm-hmm. And then, so I think the approach is similar, but in that, I think that felt it was really important to engage women. Yeah. So that we don't kind of perpetrate the same gender dynamics of like we're only working with men.
Yeah. The reason that is that there are many contexts where it is more appropriate for men and women to engage in this kind of intervention separately. We felt that in this context that was not appropriate because many of the exercises involved the men and women practicing better ways to speak to each other. And when I say better, I mean like less abusive, either physically but usually verbally in the context of the group meetings and the individual meetings. So for that practice to happen and for some of those honest conversations to happen, they needed to be in the same room, in the same sort of setting. We also, in the individual settings, worked with their child, if the mentor works with their child, so it was very personal to them. That wouldn't have worked if they'd been in separate settings. Culturally, we didn't have the same restraints that some contexts have in having large group meetings with both men and women. That wasn't the case in either parts of Uganda. And women were very annoyed at first when they thought that they weren't invited to these group things because, as I say, they just wanted to know what their men were being talked to about. They were very suspicious. And so once they joined, they were like, okay, well, I guess you're not telling them like really terrible things about us, or, many of them didn't particularly trust their husbands when it came to the financial side, and they felt that maybe this was something to do with an intervention to give them more financial control, which would make it hard for them to care for their kids because of the substance abuse problems in some parts of where this intervention took place. So very context specific, and it's completely up to the curriculum that you're using and the place that you're doing it, whether you would have men and women apart or together. But we thought a lot about it, and we decided together.
Thanks. Yeah, very interesting. Is there any other questions for Doug? No, well, thank you very much. I think that was very, very interesting. And if you can share with us the curriculum so that then we can circulate to the task force members.
Yeah, I will do. You can find them. I'll send you the link, but you can find them all on Institute of Reproductive Health's website, and I'll also send you the papers where you can read more about the results.
Excellent. Thank you.
Okay. Well, thanks very much for the opportunity to present on this. It's a really great program that has lots of implications for other people's programs. So I'm happy to answer any questions over email if you would like to talk further about it.
Thank you.